Joining us now is Dr. Douglas Lurie. Douglas, thank you for being here.
Thank you for the invitation.
Of course. So we're talking about rotator cuff tears today. How do they happen?
There are two main ways the rotator cuff tears happen. Probably the most common is a fall on the shoulder, so just a fall with a direct impact. And the other is just as a result of wear and tear over the course of life.
Right?
Mm-hmm.
Yeah. Yep. My father's one of those wear and tear people who had surgery, so not fun. However, tell us a little bit about what we have on the desk here.
So one of the things that has improved over time with rotator cuff repairs are actually the implants that we use. This particular implant, the actual, what looks like a screw, absorbs over a period of about 2 years. There's no metal that actually goes in the body, and this basically turns into bone. As well, the sutures that we use, which are a combination of basically nylon and polyester, they're very, very strong, very difficult to cut. Like you almost can't cut them with a knife.
So you said this turns into bone? How does that, that's fascinating.
Bone, it's a combination of calcium phosphate and then a material that's sort of like an absorbable stitch or an absorbable suture. And over about a 2-year period, it turns into bone.
That's unbelievable. Fascinating.
It's very difficult to pull it out.
Mm-hmm. Yeah. It's a tough one. Okay, and then this lovely device is what you get to wear after surgery for a while, right?
Yes. One of the things that's important about rotator cuff repair is trying to understand what you have to expect over about a 6-month period, and the first 6 weeks you usually have to wear a sling like this. They've gotten more comfortable over the years, but
good. Yeah.
It's still an expected part of the recovery.
Sure. And then what about sleeping? I mean, do you sleep with a sling on, or what's recommended?
Most patients sleep with a sling on. You don't have to sleep sitting up. A lot of patients actually sleep in a recliner because it's more comfortable.
I was going to say, and you're probably not moving around as much if you're kind of limiting your movement a little bit. Okay. All right. So how do you diagnose a tear?
A lot of times you can make the diagnosis just by history and exam, but the next step after that is typically to obtain an MRI of the shoulder.
So what are we looking at on the screen here?
So there are 2 pictures. Figure 1, you can see where it says normal rotator cuff, how that layer of tissue goes all the way over and attaches to the top of the humerus or the arm bone. And on the second picture, you can see how there's a big gap where it says fluid, and that's basically where the cuff has detached.
Okay. So is it just the pain that kind of alerts you that something's wrong, that you may have an issue with your rotator cuff, a tear?
It could be pain. It's also a lot of times weakness, and people have typically a very difficult time sleeping. So you can't sleep on that shoulder.
Right. So. Okay. Not fun.
No fun.
Okay. So how do you fix a tear arthroscopically?
So arthroscopically basically refers to us using a camera and instruments to work inside of a joint as opposed to a big open incision.
I see.
And typically we use 3 or 4 small holes that are about a 1/2 inch each, and that allows us to have access to do the repair.
Okay. All right. And that's just I mean, we've come so far with the technology. I mean, can you speak to that a little bit?
It definitely has improved. I think things that have improved is we do a better job managing pain after surgery. A lot of times we use what's called a block to block all the nerve endings in the arm to make it so you don't have pain for a period of anywhere from 24 to 72 hours.
Oh, wow. Okay.
We also usually do an injection with local anesthetic, and we use a cooling unit type ice machine that you mentioned your dad had.
Right, he did. Yeah, that was a savior for him, saving grace. Okay. Anything else that you think is important that people should know? I mean, when they come in and you kind of take them through the process of what this will be like for them. It can be life-altering for a while anyway, right?
I think the most important thing that I try to reiterate to my patients is that it is a long recovery. It usually takes about 6 months to get better. It's much better to know that on the front end than to figure that out, after the fact. If you know it's going to take 6 months to 9 months to be able to lift a gallon of milk to the top shelf in the fridge.
Oh my goodness, right.
Then your expectations are better managed. Also, I think we've done a better job identifying things that lead to failure of the repair, and those are things like diabetes, poor nutrition, cigarette smoking, and advanced age.
I see. And do medical services help cover this procedure at all, or?
It's usually covered by insurance.
It is, okay. Okay, good to know. So there's no reason then not to have the surgery. And I'm a big fan of surgery. I mean, people usually try to avoid it, but I think that, it really does help make you better.
In the case of a rotator cuff tear, the natural history of an untreated cuff tear is that it will worsen. So if you ignore it, if you avoid it, over time it will worsen.
Sure.
So
You don't want to do that. All right. Anything else you'd like to add?
I think that's it.
Pretty much covers it? All right, wonderful. Thank you so much for joining us. Now, to learn more about Orthopaedic Associates of New Orleans, you can visit their website, oano.com. You can also call them at 504-899-6391, and they're located at 3434 Britannia Street. Well, there's much more to come on Great Day after the break, so make sure you stick with us.